I think the issue really is the historical way that we have looked at what the LGBTQIA group is. Is it actually the tree or is it the reflection? And I think if we are able to actually look at it from the point of view of redefining the problem, is it in the identity that you are whatever the letter denotes, or is it in something else? Because from there will come the needs. So if the problem is not medical, which is what now, whether it is WHO or it is the IPS, everybody agrees the problem is not medical. It may require interface with mental health care and with healthcare, but are we actually looking at the impact of something else and calling it the problem? So are we looking at the reflection rather than the actuality is the actual question. Next slide, please. So if that were to be the question, then what are we really aspiring towards? Because solutioning will come from there. So what are we trying to find a solution for, and what do we wish to manage is the question to ask, because then we can arrive at who needs to make that change. Yeah, next slide. So if we all agree that the problem is coming from the social narrative, it is not in the person who is born and grows up in this society, who discovers over a period of time that their identity is or their sexual orientation is what it is, then the problem is social. And the problem is in the stigma and the shame, which is not from inside the person. It is not from the identity. So the solutioning should come from where? Thank you. I'll end my talk. So it'll have to be social. We cannot ask repeatedly of identities that you have to come out and take the onus of telling everyone and going through the reaction and then explaining what the identity is about, which is what we often expect. We say, this person has not said anything till now, so I should just keep shut. We know what's going on. A lot of parents tell me when I'm sitting in the room, of course we knew something was not the same, but we won't ask. The onus is entirely on the individual, not on the social structure. And that has to change. So the solutions that we're talking about need to be created within the social structures, by the social structures, which is all of us, and for the social structures, because in our country especially, it is not the individual alone. The entire family is connected to the identity of the individual. The individual is connected to the caste, to the neighborhood, to the extended family, and the identity of being either a particular gender or a particular sexual orientation or a particular body type is actually not owned by the individual. So who owns my gender in India? Who gives me my gender in India? When a child is born, is the child involved in actually figuring out and saying, I'm a boy, I'm a girl? So the gender is assigned by someone else and then taken as the universal truth. All these are questions that I think we leave to the individual to answer. And if we are able to change that, a lot of what we are trying to do in terms of needs will become quite obvious. Next slide, please. So solutions wise, this is just one suggestion, a participative guideline. I'm not going to go into the guideline itself, but the guideline has to be, next slide, the guideline has to be not about what the individual has to do or what has to be done to the individual. It needs to be about, if I'm a family member, what should I do? If I'm an employer, what do I need to do? If I'm a teacher, what do I need to do? So all the social structures, but whether it is a social structure as well. So for example, a school, the school says, what do I need to do? Or the organization says, what do I need to do? Not wait for someone to come out. So I think those are the kind of things that are terribly important, and those are the needs. And one of the young people that I'm working with said that the safest thing, that they went through 5 therapists, and the safest thing they felt when they landed upon a therapist is not anything else is to accept the identity that the person was talking about. And the first question they asked was, how can I support you? Rather than how, when, where, evaluation, etc., etc. I talk about one more young person who I think really affected, and this is very recent, it's about 3 months ago, then this person said, I don't want to be included. He's a 19-year-old. I don't want to be included. And my jaw dropped and I said, what do you mean? He says, I don't want a system in which first it is built to exclude me. I'm at the periphery. And then you're going to work very hard to include me. I don't belong in that system unless you change the center of that system, unless you change that system to see me for who I am and build it around me. I don't want that system. I do not want to be on the periphery of a system which is built for a typical individual and then said, add on the LGBTQ lens, let mental health practitioners have a 6-week queer affirmative course, and then they become queer affirmative. I want a system that looks at diversity, celebrates it from the center, and then I will say this is my system. So I don't want to be included in the system that you're trying to suggest. I'm going to end there and say that I think the time for change is already here. A lot of people say India is not ready for this kind of a change. This is a Western concept. But look at the pride marches. These are the number of pride marches that are happening across the country every year now. Whether it is Gujarat or Siliguri or Delhi, you see that everywhere in the country this is happening. Change is here already. We are sitting in a transitional time, and I believe that we are sitting in a time where historically the decriminalization that has happened is just about starting to give light to the progression of saying, let's celebrate all kinds of people. And this is not just about the LGBTQI diversity, it is about all kinds of intersections. Let's build systems that actually center individuals and human dignity, regardless of the intersection. Thank you.